So I'm going to do a quick demo on how to assess the pelvic floor muscles and how to integrate it into your treatment program. So the first thing that we're going to want to do is look at how Anne is breathing. And then we're going to look at how she is able to generate her abdominal wall, and then also how she's able to contract her pelvic floor muscles. So Anne, what I want you to do is just show me how you breathe. Breathe in and breathe out. Good, and go ahead and take a deeper breath. Good. So I do see a little bit of movement through the rib cage, but we're going to work on that when we do the pelvic floor muscle contraction. Okay, now Anne, I want you to try to tighten your abdominals. So go ahead and squeeze your abdominals. Okay, and then relax. And then try it again, squeeze, and relax. Okay, so Anne actually does a pretty good job of activating her abdominals, but most patients that you'll see, they'll be sucking in their stomach, and they'll have a lot of rib cage elevation. Now the next thing that I want you to do, Anne, is I want you to contract your pelvic floor muscles. So squeeze your muscles like you're going to stop the flow of urine. Okay, and I feel a little bit more muscle activity on the right versus the left. How does it feel to you? Do they feel, the goal is symmetrical muscle activity. So what do you feel? That's better already. Okay, so the pelvic floor muscle contraction, as we saw in the beginning of the slide, you're going to have a squeeze and a lift. So I like to use a little guided imagery. So Anne, I want you to visualize that your pelvic floor muscles are like an elevator. So you're going to close the elevator door, and then you're going to pull the muscles upward to the first floor. So go ahead and close the elevator door and pull up. Good, and then relax. How does that feel?
That's fine.
Can you feel your muscles working?
Yes.
Okay, good. So there's two types of contractions. The first contraction is a short contraction, and that's for coughing or sneezing. That's to maintain continence for coughing or sneezing. And the second exercise is long contractions, and this is to maintain continence when you're lifting, during transfers, and walking. So we're going to start with the quick contractions first, and then we'll go to the long contractions. So Anne, what I want you to do is I want you to get a little bit more expansion through the rib cage, because we want to get that co-contraction of the pelvic floor muscles and the diaphragm that we talked about earlier in the presentation. So Anne, if you can imagine that your rib cage is like a compass. So when you breathe in, you're going to breathe in east-west. When you breathe out, you're going to go south. And I'm going to actually give you some cueing through your rib cage, okay? So go ahead and breathe in, east-west, good, and breathe out, you're going to go south, good, and breathe in, east-west, and breathe south. If your patient is a really shallow breather, or they're really having that upper chest breathing pattern, you can have them breathe in, breathe out, and then hold that position, and then breathe in and out to this new position. So but Anne's has pretty good control of her diaphragm, so I'm just going to cue her east, west, and south with the rib cage. Good, so as you do the pelvic floor muscle contractions, I just want you to keep breathing normally, okay? So go ahead and breathe in and out, good, and you're going to squeeze and lift, and then let it go. And then squeeze and lift, and let it go. Just keep breathing, squeeze and lift.
Should I tie them together more?
You can time it together, but the main point is just to breathe. So sometimes patients will have a really hard time getting that coordination. So because Anne has really good coordination, what I'm going to have you do is go ahead and breathe in and breathe out, and you're going to squeeze and lift. And then relax with the inhale. Okay. Relax your pelvic floor, good. Exhale. Squeeze and lift. Good. Breathe in, relax, pelvic floor, breathe out, squeeze and lift. So you could coordinate it like that. or you could just have the patient squeeze and lift and just breathe normally. The second exercise that we're going to do are the long contractions. So now, Ann, I want you to hold it for 10 seconds. So you're going to breathe in, breathe out, squeeze and lift. Your pelvic floor muscles, hold 1, 2, 3, 4. Keep breathing as you squeeze. 5, 6, 7, 8, 9, 10, and relax. Good. How is that? Can you feel your muscles working? Your pelvic floor muscles? Okay. Try it again. Breathe in. Breathe out. Good. Squeeze and lift. Hold 1, 2, 3, 4. Come on. 5, 6, 7, 8, 9, 10, and relax. So, Ann, is this challenging enough for you?
Yeah, it's just a matter of thinking about it.
Okay. So if she said no, what we could do is then we could add in the abdominal brace. So let's just try it. So I'm going to have you breathe in, breathe out, squeeze and lift your pelvic floor muscles. Good. And gently push into my fingers. Good. And hold it. 1, 2, 3, 4, 5, 6, 7, 8. Come on. Breathe into my hand. 9, 10, and relax. So then you could start adding in the abdominal brace. But typically, sometimes you may just start with the pelvic floor muscle contraction, just having them to feel that contraction and lift. And then if they're able to coordinate the breathing, you would add in the breathing, and then you would add in the abdominal brace. So sometimes it has to be more like baby steps, depending on where the patient's at. Okay, so now we're going to integrate this into function. So Ann, I'm going to have you stand up. Okay, so say that Ann has urinary incontinence when she coughs or sneezes. So again, those are those quick ones, those quick contractions. So what you're going to do is you're going to squeeze and lift, and then you're going to cough. Okay, so go ahead and try that. And I'm just going to feel your pelvic floor muscles. Yeah, squeeze and lift and cough. Good, and relax. Okay, try it again. Squeeze and lift and cough. Good. So every time you would have a cough or sneeze, you're going to have them tighten the pelvic floor muscle before, getting that pre-contraction. Okay, the second exercise for the long ones, say that, Ann, you're having some leaking when you're lifting your baby or lifting the trash to take out the trash. So what you're going to do is you're going to tighten your pelvic floor muscles, breathe out, and then you're going to lift. So tighten the pelvic floor muscles, breathe out, and lift. Okay, so go ahead and try that. So go ahead and go to your spot. There you go. And then I'm just going to feel her muscles just to make sure that she's doing it. So tighten, breathe out, and lift. Good. And you actually want to, the more that you can actually see the breath and that they're breathing out through the mouth, you know they're getting more movement of the diaphragm, so it's going to be better co-contraction of the diaphragm and the pelvic floor muscles. So go ahead and try it again. So squeeze, breathe out, and lift. Good. And were you able to feel your muscles working?
It's harder to feel, but yes, you can feel a little bit of this.
Okay. Okay. Done.